The recent New York Times investigation into the practices of MultiPlan, a little-known data analytics firm that works with major health insurers to determine reimbursements for out-of-network medical claims, highlights the dangers of perverse incentives that emphasize profits over the welfare of patients. The Times investigation revealed several alarming findings. Patients hit with unexpectedly large bills sometimes forgo care or cease long-term treatment. MultiPlan's recommended payments not only push back against known overbillers, but can also squeeze smaller physician and ancillary practices. Insurers pitch MultiPlan to employers to control costs, but the fees can be onerous and unpredictable, funneling savings away from self-insured employees. Former employees at MultiPlan described a numbers-driven culture that encouraged locking in unreasonably low payments and tied their bonuses to the reduction. The growing influence of private equity in the healthcare sector significantly contributes to prioritizing profits over patient care. Over the past decade, private equity firms have increasingly invested in healthcare organizations, including hospitals, physician practices, insurers, and ancillary services. These firms typically aim to maximize returns for their investors within a relatively short time frame, often by implementing cost-cutting measures and leveraging economies of scale. These firms also burden their companies with massive debt that limits their ability to provide proper staffing, upgrade infrastructure, and expand essential services. While private equity involvement can sometimes lead to increased efficiency and improved access to capital, it also can create perverse incentives that prioritize short-term financial gains over the long-term well-being of patients and the stability of healthcare providers. As a physician, I believe that proper patient care should always take precedence over profit. The increasing involvement of private equity firms in the healthcare sector, with their singular focus on maximizing returns, is a worrying trend that demands closer scrutiny and regulation. It is time for policymakers to act and implement stronger regulations for companies that provide healthcare reimbursement services, especially those that are for-profit firms. The incentives are too strong for these companies to emphasize profits over patient care, and the consequences for patients and the healthcare system are too severe to ignore. We must work together to create a fairer, more transparent healthcare reimbursement system that prioritizes patient well-being over corporate profit. Only then can we ensure that all patients have access to the care they need without fearing financial ruin. I look forward to your thoughts, so please put them in this post and subscribe to my other video series, Navigating the Code, on my Dr. Barry Speaks channel on YouTube. Thanks for your time today.